And then it was meant to enable people to increase control and to improve their health and well-being, even though health promotion is actually a new and evolving field. But then these things have been actually been there since in the past and all that. If you also look at the ninth Global Conference on Health Promotion, it had a slogan, health for all and all for health. And is actually a commitment, it captures the commitment to leave no one behind and to involve all actors in a global partnership. So coming back to health literacy, you have what we call the individual or personal health literacy and the organizational health literacy. In the organizational health literacy, the degree to which organizations equitably enable individuals to find, understand, and use the information and services to make health-related decisions. Okay, so and then we know that everyone has a right to health information that helps them to make like informed decisions. Health services, of course, should be delivered in ways that are understandable and beneficial to health. And it should also be like person-centered health information. Usually, we should actually move from community or probably general health information. Okay, and then the limited health literacy is also associated with what higher cost. Just to explain the ways that health should be delivered in ways understandable and then beneficial to health is that sometimes we as physicians, like people come in, or probably you have patients coming in, and you don't really have the time to actually explain basic things. And this is actually a primary prevention. Health literacy is all about primary prevention. There was a study that was being done in America, and then it was said that it actually doesn't take the physician's time. And I think we as individuals should advocate for like preventive medicine than the curative, because the time you spend to explain something to the patient and then the patient understands it, then they become responsible. They take part in the management of their own health. Then they understand better what is wrong with them, or in case they have issues and all that, who to contact and things like that, or when to come back to the hospital and all that. But most of the time, there is actually a break in communication. We don't talk to our patients. And then
Safety by Tepe. Got a couple of throat.
I think I was muted. So most times, like we don't really talk to our patients, and then this also like affects us in many different ways, because patients whom you know that they have like a low health literacy would actually go to the emergency rooms, or we might be seeing them quite often and all that, because they really don't understand what is going on. And it just takes probably like maybe few minutes for you to talk to the person and make sure like they understand what is going on with them. So the importance of health literacy to the society is that it empowers the population to take control of their health. Then it decreases cost, of course. Decrease cost in a sense that we will not be actually be at the level of like tertiary prevention, as I said, or intervention. As I said, the focus is the primary prevention, and that is the most important. So once you are able to tackle the primary prevention by making patients understand and all that, it helps to decrease cost in the future, cost of medication, of course, the hospital bills and all that. So, and then it also leads to better health outcomes, and then it improves the health quality of millions of people. So you find out that higher levels of health literacy within populations yield social benefits as well. The reasons for low health literacy, it's because healthcare providers use words patients do not understand. Sometimes somebody calls, probably they have a low HB, and you tell them you're anemic. They don't know what anemia is. So you need to use at least a language that they will understand. So if you use languages they do not understand, then it means that there is no communication. And the primary purpose is for you to actually send your message across clearly. Because if you don't, these patients might be misinformed. And then that is why we need to have a clear communication, or you need to set clear information. You need to give them clear information about exactly what you want them to do, or how they should manage their conditions and all that. The other reason for low health literacy, of course, is the low educational level of most people, especially in our setting, but even in the world also. You have countries, they also have a high literate population, but they still have people who are uneducated. And health is not, people are not really advocating for health coverage. Now you're actually advocating for health care. You have to give people the care that they need. And of course, you need to look at as well the poor people, because most of the times poor people are actually the ones marginalized, because probably they don't have like the money to actually get education and stuff, especially in countries that you don't have any free education and all that. So the other thing also is the cultural barriers to healthcare. And then this one, of course, communication is the one tool that can actually break these cultural barriers as well. So if you're in a setting, maybe like those people don't speak English, right? So you need to at least try maybe and communicate to them in the language that they understand. And that is why also it's also an advantage for people to actually try to learn languages, because we know, especially in Africa, English is not our first language. We have our mother tongue, and then those are in different languages. So if I come and then say something in English, the person will not understand. So you need to interpret for them in the language that they understand, so that at least there'll be that communication. And then you give them the floor to be able to ask questions and all that. So this actually, once there is communication, then of course then you're going to create an impact in the lives of these people. The other thing, of course, is the low socioeconomic status. Of course, I briefly explained that. And then the minority groups. Yes, the minority groups also like have a low health literacy, in the sense that because they are in the minority, probably, okay, if they don't speak English and all that, and then you are in a country wherein you have, like, of course, you have some major languages that people speak. So again, if you educate these people and you don't learn that language, again, there is also a barrier, you understand, in communication and all that, because then the minority group will not also benefit from that. So, and then the other thing is that when people are also disabled, disabled people, even though we say, yes, they are differently abled. Sorry, these are new terminologies that we have to acquaint ourselves with. Okay, maybe they are differently abled. Yes, so you find out that probably they might not go to health facilities to seek healthcare advice, or because maybe it might take a long time before they actually get to these facilities, and they don't have any healthcare providers actually reaching them. That again causes low health literacy. Of course, age is another factor, especially people who they are of older age. What happens is, because of their mental status, you understand, they also tend to have like a low literacy level. So I also looked at another topic to look at the relationship between the health literacy and the SDGs. I will mention a few SDGs, especially SDG 1. Of course, we know which is no poverty. If we reduce poverty, we can improve the health literacy level. Of course, we know in that also, like, education comes in, it will have a role to play here. Because if you're not poor, then of course probably you could afford education for your kids and stuff when you send them to school. You understand, at the end of the day, they have at least basic knowledge and all those things. And at least that will also help to improve their health literacy level. I am not talking about those who, they're in sixth grade below. Yes, I'm talking about those who, like, at least they'll be able to go and achieve probably junior secondary or a tertiary level of education. Because research has also shown that people in grade six actually coming down also have zero hunger. So people with higher levels of health literacy are far more able to understand nutrition and to be empowered to make healthier choices. Of course, Of course, they might know the importance of actually breastfeeding, the advantages of breastfeeding babies. This is just an example, unlike formally feeding babies and all that. So once they know that, we can end malnutrition in all its forms, whether it is undernutrition. Most of the time is undernutrition in Africa, and not like overnutrition. But both ends, extremes, of course, is malnutrition. So malnutrition is not only about those who, they're teen and all those things. Okay, probably sometimes that is how we interpret it. We think if somebody is small, the person is malnourished, and especially in African setting, when you see like a fat person, you say this one is healthy. You don't even know that that one too is sick. So these are the things. The other thing I would also want to talk of is the SDG 4, which it talks about quality education. Adolescent girls will have access to sexual and reproductive health information, often through peer education. They can better protect themselves from HIV, sexually transmitted infections, and unwanted pregnancies. Um, I don't know whether somebody might be thinking I'm gender biased. I said adolescent girls, but that is the reality. The girl child, the day you were born, you are even discriminated. The first day you were, the first day you are even born. um and then like people will start judging you and all, and we know this is something very common in our setting. And then of course we need efforts, we need to work vigorously hard, right? I know the boy child is very important, but most of the time it is the boy child that actually is, much attention is given to the boy child. Okay, because families think that is more advantageous for them. The girl child will be married off and all that. But remember, even if she is married off, she's going to have a family, she's going to have kids. So how is she going to bring up those children if, she is not educated? She has been denied education. And then the other thing is like we also feel, is a waste of time, like educating girls and all that. And that is why there's a lot of issues going with, that happens to the adolescent girls. So I feel there should be some level of equity, because if they are educated or they're given quality education, then they now understand the issues surrounding sexual and reproductive health information. Of course, the issues of, they might even prevent teenage pregnancies and all that. And then of course the other thing is like, in some schools, when a girl child is pregnant, she is denied to continue her education. We can actually prevent all these things from happening, or we give them the opportunity to go back. But before then, if we tell them about preventive things, sexual education, give them sexual education and all that, it will help to lessen those things. We will not be having these problems. And then the other thing I want to talk about is the SDG number 8, which talks about decent work and economic growth. Of course, health promotion includes concerted efforts to elevate levels of health literacy amongst workers, including messaging on how various work environments can impact upon health. Then SDG 16, of course, refers to peace, justice, and strong institutions. Those with higher levels of health literacy are empowered to hold their governments accountable. This an example of this is the AIDS response. In the AIDS response, we've seen that there have been improved health literacy, and this has actually led people to know their rights while demanding equal access to treatment and, of course, preventive services. The roles of government, we also need to look at the roles of government in health literacy. Health literacy can be improved through the provision of information, of course, effective communication and structured education. Governments can take a strong leadership role in developing and implementing health literacy, promoting policies by providing sustained funding. And I can give you an example. In China, if I can remember, I think is in 2008, they had to set this health literacy policy, and then it actually costed them about 40 million US dollars. And then the surveillance data actually showed that there was a kind of improvement in health literacy. And this was not just like an area or a region in China, it had to involve like the whole country. And then the literacy level actually rose among Chinese residents. So health literacy surveillance regularly will also help, and then, us African governments, we are good at starting things, but we don't sustain anything. And it's also important to strengthen participatory and representative decision making about health literacy development and equity at all levels will promote individual and community action for health. Um, I believe governments must take steps to increase and sustain their own health literacy, encourage adult literacy. In the past, well, I don't know if that actually happened in other African countries, but I remember in Gambia in the 90s, I was young though, but then we had this adult literacy that was going on in which like people who work as maids or maybe had no educational background and all that. What they do is they have these night classes, they go for night classes and all that to at least develop like basic knowledge about the English language and all that, so that at least they'll be able to communicate. And then that actually had a lot of impact, but since then, I don't think that that program actually faded away. But then again, if you look at it, it will actually help us in trying to actually promote like health literacy. We'll be able to communicate to people, knowing that we could have used that as an advantage to continue it, knowing that we have a high number of illiterate population. The illiterate population in Gambia is very small. So actually also government should support and expand local efforts to provide adult education, of course, English language instruction. And then they should use linguistically appropriate health information services in the community. Finally, all of us must work together to make sure that health information and services are provided in ways that meet the needs and interests of the people. And then we also need to eliminate barriers and improve the way healthcare and public health professionals, educators, and the media communicate health information. We need to offer the best opportunity to achieve a health literate society. Okay, basically that is what I have for you in this presentation.
Hey, up to Farhano then. Farhano, I not for the country. Life of you, service.
Thank you so much. Um, Thank you so much. So we are happy that you have been able to present about the health literacy. And I am wondering whether we have anybody with a question from the audience. And please, once you join the Zoom room, ensure that you mute yourself, because if you talk and the speaker is talking, and then that becomes noise. So just mute yourself. And I'm trying to mute some people, and it is impossible. I don't know why. And yet I'm the host. So yeah, so I can see he has muted himself. That's great. So anybody with a question is to regard with what our speakers talked about the health literacy. She has given the definition of health literacy, and I have a question, because you have said that the meaning of health literacy is the ability or the degree to which an individual have their capacity to obtain, process, and understand basic health information. So the access. Now, the access has to be, that means that the information has to be provided. So
Yes.
is it only the government which has the sole responsibility of providing the information, or even individuals have the responsibility of providing this information? Because as per the definition, it means that the information has to be provided by somebody or a group of people.
Yes, it depends on the context that you're looking at from. Of course, individuals also have a right to actually provide information for themselves. But again, if somebody does not give them the information, where will they get it? Unless and until now that we live in a technology wall and all that, and people seek information and all those things, right? But this is just a small number of people. You understand? So it is our duty, even organizations as well, should be able to provide information to these people. But if somebody is not educated, they don't have access probably to internet facilities, you understand, and then they can't ask anybody. So how would you expect them to get that information as well? You know, and then this is the issue. If you're talking about somebody who is educated, of course, I can just go in and then get any information and all that. And sometimes even with the educated individuals, we also have to be very careful because people go get information and then the information that they are getting is not actually the right information, because now even if you go on the internet, there is a lot of information and all that, but it's only somebody who is in that background or in that field in which you're looking for, the information that you're looking for can actually guide you and then give you can give you information that you need. But of course, if somebody does not give you the information, how are you going to get it? Yes, if you're educated, you can go on and get the information, but are you sure even whether you're getting the right information? So
Okay. So another question, still on the same. I didn't hear you mention something with ignorance, and I believe you are left the fact that people are ignorant, especially we Africans. I don't know about other races, but as a matter of fact, we Africans are very ignorant. And to be specific, we Kenyans, because now I know Kenyans better, we are more ignorant to basic information. Like let's take, for example, the COVID-19 thing. There has been a lot of information going around, a lot of awareness being created that people should wear masks, people should sanitize, people should try to maintain social distances and such kind of things. But now someone will come and say that this is an hoax or it's something non-existent, and you find that people ignore information despite the fact that it has been provided. They choose to ignore. So what do you say about that? The information has been provided and people decide to ignore. Your comment on that?
Yes, I agree with you, but well, ignorance is a disease actually. You ignore it, then of course you have to hold yourself accountable to it because the information has been given to you already. So if you and then sometimes, you know, it's not even, you know, these people just refuse to just take information, you know, and then when people do that again, it's actually it's very difficult and it's complex, especially when people don't want to really believe or accept something, you understand? So in that case, unless you engage them over and over again, I know some people would not change even if you do that, but then at least try to do your role, you know, do your part so that at least you can go to bed. When you go to bed, you can sleep, you know, and then it's up to them if they want to use the information that they've been provided, but they will never hold or accuse anybody for not having given them that information.
So anybody else with a question from the audience so that we may release our speaker? Anybody with a question regarding to health literacy? That was our discussion today. We were talking about health literacy. Madam Stephanie explained what health literacy is, and she also talked about the role of the government in providing this information which will make people health literate. And also she also talked about the role of organizations and also the role of individuals on what they have to do to ensure that there is health literacy among all groups in the society. So anybody with a question in regard to that? Or a statement, maybe congratulating her for the presentation, although most of you have joined while she had already started, I understand. Ibrahim, you have something to say? In fact, okay, Ibrahim, this our today's speaker is the one who was answering most of your questions last time. She happened to be hearing you and you are not. So maybe she was God sent because she managed to answer all your questions that Saturday. We can't hear you. You have muted yourself, Ibrahim. Or you are not saying something.
Well, I want to say it. I want to say it.
Okay.
Good afternoon. Let's say good afternoon to our side, Hispania.
Good afternoon.
Also, good evening to those from Eastern Africa, more specifically, the brothers and friends from Somalia, Kenya, Djibouti. Also, today we have a specific delegate from Ethiopia. So, once again, nice to meet you. Actually, the issue is all about health literacy. I think yesterday we had negotiated by the issue and also asked question by sister Victoria Stefania.
Yes.
So I think this goes or follow up yesterday's question, similar. So the question that I want to ask you is that in order to promote the health literacy, do you think the society can have a role? More specifically, business owners and the other group who are familiar with the issue. Do you think the role of the site also can play a role instead of waiting the government or any other international support?
Yes, the society, of course, they can play a role in the issues of health literacy. And then if you check it, even with the determinants of health, if you really want to succeed, you have to involve the community. You know, the community has a role in actually trying to help you like health literate. They can actually, even those living within the community, they can actually organize themselves, and then they find ways of actually improving literacy. Maybe, let's say, for example, also like talking about air pollution, pollution affects everybody and all that, like an example. Okay, so and then again, even with these communicable diseases and all that, if the society is involved, you find out that you tend to actually succeed in actually controlling these ailments. So the society, of course, has a role to play as far as health literacy is concerned. Even at home, the society also involves the families and all that. So people can actually share information. If you have somebody that of course knows something and then shares it with the other persons and stuff, this has nothing to do with government. Information is meant to be shared. So in that way, also society can actually play a role. There's nothing one can do without the society. If you have a strong backing of the society, then you're more likely to succeed.
Uh, Thank you. I want to question you with regard to the issue in another way. So the second question that I will is that suppose most African states,
I'm not
their
hearing.
governments. Can you hear me?
No, seem far.
Uh, let me use.
We can't hear you completely, Ibrahim. Check your mic. We can't hear anything from your side.
I think so, Ibrahim. We are not hearing you. So, Mike, if you are hearing me, please, I want to ask you, the Stephen. People, for example, most of my name is Mohammed Ibrahim. I'm from Somalia. I am part of the group, so I was not aware the time that he was starting, but now I had the issue of the people when they start, for example, when they want to also start the business or maybe something, they need to give them awareness to know what they can do. But most of them, they are fearing to start to start the business, and I think so is when you don't know how you can start or how can how you can do. So what I think people before they start, they have to be confident. I think so. So how can they get the confidence?
Okay. Mohammed Ibrahim, I think we are talking about health literacy.
Literally, exactly. So I was like, which
So
business?
your question is not really in line with health literacy.
Okay, okay.
Yeah.
Uh, hello.
Hi.
Yeah. Estefania, it
Yes.
is Ibrahim. To the point that related to the education. Suppose we analyze about the health literacy. So in Africa, suppose majority of them, they are not still enough in terms of education.
Mhm.
Do you think that adding the curriculums at secondary, primary level, and other major courses about the health issue can improve the awareness level of the society?
Yes, of course. If you incorporate, in fact, sorry, I'm saying that's not English, what I just said, sorry. If we incorporate these things into the health, into the curriculum, of course, it will actually improve the health literacy. And then I said it here, education plays a vital role, and education entails many different aspects. So again, if we are incorporating health into our educational system, that will be more advantageous for us, because at least like these people will have like they already have like primary knowledge. Even if we are going to add something, it might be something very little basic. And then also we would empower them, because by the time they leave school, they will also learn to ask questions. They will not just go to somebody and stuff like that. And then it also helps to build up the confidence. Because at the end of the day, when you have little knowledge regarding something, then of course you become more confident and then more relaxed in actually asking. If somebody tells you something, you can say, well, and then what are the side effects? What do I expect? You see this even in the rooms, and what will I say again? Where we see patients, right? And then you can actually tell the difference. Even with so many issues with regards to maternal mortality and all that, you find out that it is actually higher in people who, they are illiterate. They don't know anything about their health and all that. So of course, education plays a vital role. If you incorporate health literacy in the education system, that actually will go a long way to help solve so many problems. So you are right, it should be incorporated in the health system. And then in some countries, actually, they have actually included it.
Okay, I have a question.
Thank
Thank you for answering, Ibrahim. So I have a question, and then from there we will land over questions to one more question to any other person who has a question from the audience. And then, so my question is to regard also on the issue of health literacy, culture. Culture has a role to play. I believe it has a role to play when it comes to the health literacy.
What did you just say? I didn't hear that. Kacha, what's that?
Cultural beliefs and such kind of things has a role to play.
cultural belief, you mean?
Yeah, cultural way of what can I say? Beliefs, whatever.
Traditional beliefs.
Exactly, absolutely. Traditional, cultural.
Cultural. Okay. Sorry. Sorry.
Yeah, that one.
Okay, we have a different pronunciation. Sorry. Yes, sorry. Okay, cultural. Yes, I understand.
Cultural beliefs has a role to play when it comes to health literacy, correct?
Yes.
Yes. How?
Like cultural beliefs can actually serve as a barrier, to health literacy. And then that is why you need individuals who, they are culturally competent, and then of course they can provide like they can speak, the language of the people, because culture also starts from the language. If you cannot integrate into somebody's culture, or at least understand their culture, then you cannot tell them about health literacy. you know, you need to understand the background that they are coming from for you to be able to explain to them, because in that way, then that is the only way you're going to find yourself about how to actually start discussing what health literacy is about. You need to know what they believe, you know, you need to know the language that they speak. And then also you need to know their, I don't know how to say it again, their level of like acceptability towards like certain health interventions and all that. So if you don't get these things correct or these things right, of course you're not going to succeed. You're bound to fail in that aspect.
Okay, thank you so much for the answer. So one more person with a question from the audience, so that we can
Sorry, let me
get
come. I'm
Could
coming.
could you allow me?
Ibrahim Modon a bit, please. You have asked 2 questions. Let's see whether we have anybody with a question from the group, and then if we do not have, you will be the last person to ask the question and then close. So from the audience, anybody else with a question?
My PC is running low.
Okay, so without any other person from the group, let's Ibrahim be the last person to ask a question, and I can see our speaker has left her seat, so you will wait until she's back, and then you can ask only one question, please, so that we can save time for her. She's still at work. She has not left our workplace, and it's getting late for her.
I'm here.
Yeah, so, okay. Ibrahim, right?
Thank you. I think somebody left hand about other participants.
Okay. So Ibrahim, Abdi, okay, Ali has a question. So Ali, you have the floor. You can unmute yourself and ask and talk. Ali, Ibrahim, can you pronounce the name?
I unmute him. He's Abdurrahman Ali.
Okay.
Please welcome.
Unmute yourself, Ali, please. We can't hear you if you are talking. We'll have to click the microphone button, and then you can be able to talk and we'll be able to hear you. Yes, go ahead.
Are you hear me?
Yes, we can hear you. We can hear you. Go ahead, please.
Thank you, brothers and sisters. Really, I would like to take part just this warm confabulation. I'm in Somalia, especially Mogadishu, city of Somali. I'm just glad to take part in this hot debate. Really, if I glance or just cross-check my idea towards this issue, the education circumstance or educational barrier that exists in our continent or in our Africa just carries are just different standards. So I might just concentrate on in especially location that I live in. So my question is, although we live in different locations, can we discuss this issue for the different sides and demystify every person's idea, the location that he lives or she lives? Can we analyze that matter for this issue? Or are we just talking about us commonly, what existing in our continent? That's my question towards you. Thank you.
Thank you so much. I believe when we are discussing a topic, we try to generalize it and try to derive examples from every country. Not only, we don't just say that because we are from Africa, this applies to all African countries. We try to have our speakers research. And that's why we get our speakers to have enough time to research and see what happens in Mogadishu, Somalia, what happens in Nairobi, Kenya, what happens in Banjul, Gambia, what happens in Freetown, Sierra Leone, and then they combine all these, and now they come with a fronted kind of presentation, whereby they have an advanced knowledge on what happens in each country as far as the topic that they are discussing is concerned, because it is our goal to ensure that the education, because this is an educational program whereby we educate people on different topics. We try to make sure that they get to receive the finest information, true and correct, and also precise, to be factual. So that is what we do.
Thank you for your answering my question as one way, Mariko Klena. You know, although we have different just circumstance according to education, when you are just doing what is called researching concerns about education, your meaning must be, to get just a profit or benefit for your doing research. Although we have different circumstances or different standards or different situations existing in our country or existing in our locations, how can come together the different ideas that we are just sharing concerns about education, unless we concentrate on every person's special location?
Okay, thank you. I think I understand your point. And if I'm not wrong, you are trying to say that how we action on whatever we discuss, the actions that should be taken as far as the whatever we discuss, we try to implement it, not only by words, but also we try to see that actions are taken. Correct? Okay, I believe
Right,
it.
go on.
Okay, so Madam Stephanie, I would request you to make your final remarks so that we may release you, and then from there we will call it a day, a night.
Okay, thank you all of you once again for coming on board.
Sorry for those who have their headphones on. Sorry for that.
Well, my final words are with regards to health literacy. I think we should do more. I can only speak for my for my area. As far as health is concerned and all that, we've seen an increase, especially in non-communicable diseases and all that. And I think we can actually help to solve these problems if only we invest more time in trying to educate our clients or our patients. For instance, non-communicable diseases like hypertension, diabetes. It's really sad that patients might come and they don't really know like what are those things that they should do to help at least control their disease processes and all that. It's not about giving medications to the patients, right? You need to explain to them like everything that the disease entails, what are the relative risks, what it can lead to and all that. If you do this, what is going to happen to you and all that, because at the end of the day, these are the type of information that they need. And if we do that, I can tell you the amount of non-communicable diseases is going to go down, even for the diabetics. But the issue is we have these things on control simply because the patients don't know. And all these things brings additional costs, to the health system and of course to the government and all that, because they use a lot of money to buy medications and all that. And we could have saved that money by simply, educating patients and all that. So health literacy is really something that is very important. Let's try to communicate and then let's try to share knowledge. Once you have knowledge and then you share it, you know that it is going to go a long way to actually help control certain things and all that. Knowledge is meant to be shared. It's not meant to be kept. Even in our families and all that. So long as you have the clear knowledge, because again, if you're not clear about something, you can't share it. You need to be so sure of something for you to be able to share it. You can't give what you don't have. right? But then when you have something, of course, try to share it in the best interest, because at the end of the day, this is the only way that we can make our system improve. So long as once we continue to talk, once we continue to advocate, we're so much sure that things might get better. For me, that is my take.
I recognize the presence of our CEO, Hans Lum. I don't know whether he's in a position to say anything. And the last time I talked to him, he was driving, so I don't know whether he's in a position to say something. Anyway, so we can just call it a night, sorry, and a day for our CEO because I believe he is starting off his day. So to our speaker, we are really grateful that you have created your time to be with us. It's really an honor. And we look forward to having you again on the program. And we really, really appreciate that insightful presentation about the health literacy. Brian, you have something to say? I can see you opening your mouth.
Oh, thank you. I think the new ambassador, Virginia, she online or she has gone?
She has left. She has left. She has left. As I told you, she was still at work.
Oh,
Yeah, she was still at work. And
you see, Sir Hans, our COA, he messaged us.
pardon? Yeah,
Sir Hans, yeah,
yes, yes.
Sir Hans has some messages.
Okay, let me read them for the audience. Our CEO has just said thank you very much, and he has said thanks to our speaker, and also he is unable to speak, as I told you, and he is really grateful that you are able to attend to the program. So thank you so much. Thank you to our CEO. We really appreciate your support. You have been really, really, really supportive. Thank you so much. So, Ibrahim?
Yeah. Actually, I won't say anymore. So the program is on the cusp. I think nothing speech can remain. Maybe it was the last to the COA. So it was better to have also analyzed the issue of health and its significance to the continent. I appreciate you to the Sir Hans, the COA, and also the speaker and the new ambassador in Gambia. And to my friend Subas Bait, all of you, thank you.
Okay, thank you so much. To everyone, you can just go to Facebook, search Universal Care for Africa, and like the page, and also share the live feed that is streaming there. That is our presentation for tonight. Ensure that you share it, you like it, you comment, and to also invite friends to do so. Also, make sure you go to our YouTube channel, Universal Care for Africa. Let me share the link so that you can subscribe and also watch previous presentations. They are live on Facebook. Not live, I mean. They are pre-uploaded on Facebook, on YouTube, sorry. So you will just need to go to that link that I'm sending there, click it, subscribe to our YouTube, and also encourage your friends to also subscribe to our channel so that we can get more subscribers, and also our content can reach many audience, or many people, I mean. Yeah, so the link is sorry, I'm just sending it in a minute. Just give me some few seconds to get it. So just ensure that you subscribe and also invite your friends to do so, because through subscribing, you are promoting us and also ensuring that we reach more audience, because that is the link. Ensure that you click it, you go subscribe, check all the videos, try to comment in every video, even if you are saying good work or something, just give your views on it is good to comment and also like. It increases the traffic in the YouTube channel and makes it busy. So ensure that you click that link, you like and subscribe. I'm so grateful having you tonight. This marks the end of our program tonight. Let's meet on Saturday at around 7, depending on our speaker's time. I will inform you in advance. So have a nice evening and have a good day as well. So bye. Bye to everyone.
Bye.